Louisiana is yet again a hotspot for the coronavirus. We will talk about that and the Alice population. Roll it, Ed. So, when we gathered together last week to talk about the specter of the coronavirus, we did not know how far along the road we had gone. Well, this week started with the governor telling us that we are ground zero as a hotspot for the virus. We were scheduled to talk about the Alice population today with the great George Bell from the Capital Area United Way. We're going to do that, but I want to begin with discussion about what the virus is doing. And as many of you know, George Bell was the administrator at Baton Rouge General Mid-City. So you've got the chops in the medical industry. And so we'll get to Alice in just a moment. But you and I were talking before we started the show about the impact the virus and people going into hospitals are having on the medical system. Can we talk a little bit about that as we begin?
Certainly, Clay, and it's a pleasure to be here with you. I spent 30 years in healthcare and finished my career at Baton Rouge General as administrator of the Mid-City campus. What folks need to know is that hospitals are finite resources, meaning that there's a limited number of beds and there's a limited number of staff to staff those beds. And what we're finding now is that because of COVID and the influx of patients that are requiring inpatient care, especially in ICUs, it's putting a strain on that finite resource. Now, it would be one thing if there was if you have a emergency or a situation that has a clearly defined end to it.
Yeah.
But this has gone on, and now it's over a year that we've been in this state with various surges. And another thing I'm concerned about is the staff that work in these hospitals at the bedside and throughout the facilities are really getting weary. I mean, this has been a long haul, and they have sacrificed a lot. So, I guess my message to everyone is that personally, you may feel that you're not at risk of being impacted by coronavirus.
Right.
But think about the next major disaster or the car accident or a situation that requires immediate attention in the walls of within a hospital, and what that can be, how that can be impacted by a hospital that's already being stretched with staff and resources.
You know, I've got a little less than a minute before we go to break, and we'll come back and talk about this. Last year, we saw a big push, a media campaign to talk about the impact it was having on nurses and doctors, sleeping overnight at hospitals because they couldn't go home because they were needed there, so much. And I'd like to get your perspective as an administrator about that, because you've got to motivate your people, but you don't want people to check out of the system because of the strain. So here's what we'll do. We will take a quick break. We're talking to George Bell with the Capital Area United Way. We're going to talk more about the impact on hospitals. I mean, this thing is circled back on us again. It's a tough situation, and we're going to talk about it. Thank you for watching the Clay Young Show on WBRZ Plus as you look at the I-10 bridge on a Friday evening. You know, I've known George for a very long time, and he's now the CEO of the Capital Area United Way. But as we said in the open, he spent 30 years as an administrator working in the medical system at hospitals here, Baton Rouge General, Mid-City. Put yourself in the shoes of an administrator, and he or she right now is having to decide what to do with the resources in their hospitals, their medical facilities. I mean, what do you think they're thinking about and going through now?
Well, their number one concern is patient safety. I mean, that's the primary concern. Second, they have to be concerned about the well-being of the staff, the people that are caring for the patients, and the systems and processes that they have in place to provide that care. But I will tell you that with this pandemic, the other concern is how do you draw attention to the fact that the vast majority of the patients that are hospitalized with COVID are unvaccinated. So if there's a way to get that message out there, and I think the hospitals and the administrators are doing a good job of making that known, that really is the message. I mean, it doesn't matter what your belief is or what have you, but the data, the evidence shows that this is something that can be avoided, that this is something that can be reduced if the community responds to the request to get vaccinated.
Look, I encourage people to get vaccinated. I think it's an important thing. The statistics show that vaccinated people are less likely to succumb to the coronavirus.
Right.
There is so much misinformation out there, George, about this, and I think that we have to start addressing it, because I don't know that there is a real understanding of how dire this situation can be if people keep avoiding this vaccination.
Yeah, and it's vaccination and mask.
Right.
I mean, those are two proven ways to battle the pandemic, the virus, and then whatever other information is provided by our professionals, because that really this is something that can be managed. We've proven that we can manage it in the past, but with this Delta variant, we really have to be vigilant in making sure that we get that word out there.
You know, for organizations like yours and others that interact with the public, I mean, you're interacting with the public all the time with everything the United Way does. What are you telling your staff? How are you dealing with this new shift in the way we can interact because of the coronavirus?
Well, the first thing is we're following the CDC guidelines and the guidelines that are laid out by our state, our governor, and local professionals. That's first and foremost. I have to be mindful of that with my staff and our team. So we're following those guidelines. Second is we're this pandemic has produced a number of challenges for our community members, and we are trying to find ways to provide relief, support to those populations that have been most impacted by this.
Yeah, it's interesting, and the specter of a shutdown is pretty terrifying, and and that leads to the conversation we were scheduled to have when we started this, the Alice population. So we're going to take a break and come back and introduce you to the Alice population. If you haven't heard, it's a fascinating piece of data. Cannot wait to share it with you. Stay right where you are. Back with George Bell in just a moment. Asset limited, income constrained, employed citizens in East Baton Rouge Parish and around the state. It is the Alice population. The Capital Area United Way for some time has been talking about the Alice population. And the scary thing about it is these details are just under our nose and we don't pay attention to them. So let's talk about Alice. Where did it come from? How do you compile the data? You know, what's in the black box?
Sure. So the state, our state United Way Association participated in research that was conducted by Rutgers University. Mm-hmm. And this research was designed to take a look at the impact that financial strain has on households throughout our communities. And what it revealed that the poverty, folks that live in poverty, that's been a pretty stagnant number. That's been consistently around 20% or so. But the area that's above the poverty level, but below what we call the Alice threshold, which is how much does a person need to live or a household need to live and meet their basic expenses.
Okay.
So if you look at the people that don't make enough to cover their basic expenses, and we're not talking about the frills, we're talking about the basic health, education, transportation, food,
utilities,
healthcare. Yeah, exactly. Those expenses, that number then becomes a much larger number, and those are the people that are most at risk of falling into poverty if any number of things should happen. If they have their car breaks, if they're
AC
have
goes
a sick,
out or something,
a major expense because they have limited resources, they have little to no savings, and what they found is that when you look at those numbers and measure that across communities, you'll see that there's a large share of our population, households that are living in this vulnerable position.
Well, you think about it, in East Baton Rouge Parish, the population is over 440,000, and the number of households here is 163,000, over 163, nearly 164,000. And you think about if that number that you're talking about falls on the wrong side of the Alice line, it's devastating here.
Exactly.
And with the flood happening, and look, we had a flood situation maybe 2 months ago, and I'm sure that pushed some people over the threshold.
Sure. When
a household falls on the wrong side, what's the impact on the community?
Well, it puts that family at risk. Number one, it takes them it puts them in a position where they either have to seek public assistance, or in many cases, they may fall, if they fall below the Alice threshold, they still may not qualify for public assistance.
Because of how much they make.
Yeah,
income.
Because they are working.
Yeah.
They are working, yeah.
That's a conundrum. So
that is.
You are in a tough spot. You could be about to lose your home or
something
of that nature, but you make so much money that you can't go and ask for help. Okay, I want to come back and pick it up at that point and talk about the impact on children. You know, George Bell is a man of many, many talents. He's a musician, he is an executive, and he knows his stuff. We'll come back. Stay right there. So we're talking with George Bell about the Alice population here, and many of you, I don't know if you're aware, the Capital Area United Way covers a 10 parish area. So it's not just the capital city and East Baton Rouge Parish, you cover multiple parishes around us. Can you talk a little bit about what the Alice population looks like around the capital region?
Certainly. And first I'll start with the East Baton Rouge Parish. The Alice population, based on 2018 data, represents 52% of our total.
52%.
Yeah, exactly.
And what about around us?
Surrounding areas, Ascension Parish is 38%. St. Helena Parish is 59%. So we have some pretty high numbers there. But I will stress that data is drawn from the most recent Alice report, which is based on 2018 data.
So that doesn't even take into account the impact of the pandemic.
It does not.
So those numbers are probably far worse.
Yeah. My estimate is that you're looking at another perhaps 10% or more of an increase to the Alice numbers.
So we're going to spend some time in a moment talking about the resources available to people who fall into the Alice population, but I really do want to drill down on the impact, the strain it has on a community when you've got more than half your population on the bubble, right?
Yeah. So it's well, first of all, the awareness of such a high percentage of people living below the Alice threshold, it also points to how fragile communities are.
Mm-hmm.
You know, if you think about it, if someone is on the brink of falling into poverty, if they miss a paycheck or two, or if they have a car repair, an unexpected health situation that they have to deal with, that could be devastating to families and to their financial position. And then you look at the limited options people have when they do fall into financial stress or distress. Sometimes it leads to them making poor choices.
Mm-hmm.
And that's another problem. So what is a bad situation becomes worse because of the downward spiral of events that can occur after they get behind on bills and things like that.
I think when is the next collection of analysis going to happen?
2020.
So okay.
We will expect a report in the next several months, probably after the first of the year.
Are you going to do anything formal, public, when you release the information? Because
We
I
always
certainly
do.
want us to be able to talk about it here. How long does it take to compile the data?
It's a pretty robust, so it takes several months, maybe even close to a year before the data is available. But it is something that it takes a little less time now because they've already got the blueprint worked out. But it does take a while for them to provide it. But as soon as we get it, we will.
What area concerns you the most? I mean, in your region, when you look at the cluster of parishes that you serve, which one kind of makes you the most nervous?
Well, East Baton Rouge Parish because of the high density, but areas like St. Helena Parish, West Feliciana Parish at 53%, Point Capee at 53%. All of those areas are.
Well, let's do this. Let's talk about resources, because let's end on the bright side of what you can do if you are on the wrong side of the Alice threshold. Stay there. The good news is on the way. We're talking with George Bell. Can't wait to get back to it. Around here, we call this segment the Go Home segment, the closing segment of this week's show. We're talking with George Bell with the Capital Area United Way, and we've talked a lot about the Alice population and how dire it is, but there is a bright side because you do have resources for those families. Let's talk about that.
Yeah, and Clay, I want to break it into three categories. First, we've realized that the greatest need for people living in Alice is they need to know where they can get help and where the resources are. And to that end, our United Way participates in a statewide network of call centers that provide this information. So we connect the person, and that network is called the 211 network. And all a person has to do is call 211, the number 211, and they will immediately be connected to an operator who is trained at going through those resources, listening to their need, and going through over 1,000 resources that are available to them that are specific to their need and the area that they're calling from. So that's one of the things. The second thing that United Way does is we fund nonprofit programs. So through our funding process of program funding as well as project funding, COVID funding, we fund a lot of organizations that meet the needs of Alice population. And that is something that we use this Alice data to help shape or drive the decisions that are made to support the Alice population. So that's a key component of it. And then the third thing, and this is probably, we found that there are resources that are not being met, or needs that are not being met, and that Capital Area United Way has created some initiatives that are specifically designed to address those. For example, during the pandemic, we realized a lot of folks were in food deserts or food insufficiency. So we developed a United We Feed initiative that provide fresh produce to a number of families. We also have have been operating for years the Volunteer Income Tax Assistance Program. And this is one that really hits the heart of the Alice population, and that is we provide free professional tax preparation for families that fall below the Alice threshold. Clay, last year we did over 6,500 claims, tax claims, that generated over $9.3 million of refunds that went back into the community.
And you're doing this year as well?
Yeah, that's what this most recent tax year. Those are during a pandemic.
During a pandemic.
Yeah.
So we got a minute left. I don't want to end without talking about the concert that you do every December. Did not do it last year. Are we going to have one this year?
I have it scheduled for December 1st and 2nd.
Okay.
And this has been something I've been doing for 10 years.
Yeah.
I've been doing concerts at the Manship Theater, and it really is just a labor of love for me.
Okay.
But Clay, I'm hoping that we can pull it off. Last year was a big disappointment to not be able to do it.
Well, I tell you what, the next time you come in, if you bring your horn with you, we won't stop you at the door.
All right.
So it's so great to talk about resources for people in our community. We'll come back next week and talk more about the coronavirus and its impact on our community. You guys stay vigilant. Get vaccinated. I think you should. Just one person's advice. And we'll see you next week on The Clay Young Show here on WBRZ Plus and across the WBRZ streaming apps.